Hi everyone, it's Kaleem Joy, licensed midwife, certified pediatric massage therapist. And I'm doing my live both on Facebook and on Instagram at the same time. So this should help maximize that I get to see so many of you tonight, and I'm looking forward to it. We'll have everybody join us, and this should be an interesting topic to go over. And I'm going to ask you little questions, I think, to be able to see what you think. So as I was pondering about this topic of fact versus fiction, right? And how it relates to birth. So when we think about, back in December, I did a Facebook Live, and it kind of talked about how did we get here? How did we find ourselves to where we're at with birth? And I looked at some of the ways that we had corsets, and how we went through the World War, and how hospitals became, and nutrition, and the fact that women had a challenge with their blood volume and iron and bleeding and things like that, and how history and our lifestyle had affected how women give birth. Well, I want to bring this to maybe another level. In fact, being able to bring it to something new. So hopefully, as I present this to you, I would love to see what your comments are going to be with it. So let's think about fact versus fiction, all right? One of the things we know about life is that if you can get pregnant, then your body says you have to give birth. So we know this. This is something we understand, right? And so if in fact that the human species can get pregnant, then is pregnancy safe for us? Okay, there's a question. So feed me back some information on your line. Is pregnancy safe for the general population? I realize that there are exceptions to that rule where there may be extenuating health circumstances, that pregnancy may be risky for them. Okay, an insulin-dependent diabetic, for instance, someone who maybe has a major bleeding disorder or something like that. Yes, absolutely. Thank you, Jennifer. All right, so pregnancy is meant to be safe because that's how we continue to multiply our species. It's part of what happens for us. So here's the next question. Is pregnancy normal, or is it a condition? There's your next question. Normal, or is it a condition that needs to be highly monitored because something is going to go wrong at any moment? Yeah, right on, Danielle. It's totally natural. That's right. Now, we understand that some women women or birth givers, generically here, need assistance to be able to get pregnant. Maybe they need medications in order to ovulate or to hold their pregnancies. They need extra progesterone. So we understand that sometimes there are things that we need that support and that help with. But once that conception has happened, and once that baby is in there and growing, who grows the baby? There's your next question. Who grows the baby? Come on, where's your answers? Who grows the baby? Yeah, the mother, the birth giver, grows the baby. Right on, Carla. She oxygenates. Yes, Jennifer. She oxygenates. She feeds. Thank you, Katie. Mom, mom, mom. That's right. She grows the baby. Every day she eats, she breathes, she pees, she poops, her body circulates all of her blood, and her baby grows. And the baby is responsible for doing its growth and development. It subdivides. It creates its organs. It grows everything that it needs in order to develop who it is, right? Okay, so we've established, 1, pregnancy is normal. 2, the mother, the birth giver, is the one who grows the baby. As yet, technology has not figured out, that we're aware of, that you can grow a baby outside of a human womb for the entire gestation. We understand it can in those first few weeks, but it can't continue without the mother, without the human to be able to help them, right? Okay, so if pregnancy is normal, then tell me the fact or fiction. Is birth safe? Is birth safe? There would be controversy to that, because it seems that when pregnancy is going along, there are multiple tests and ultrasounds. Thank you, Jennifer. Yes, it is safe. Yes, that's right. Birth is safe. Now, yes, it is safe. What makes birth safe? Part of what makes birth safe is because it was meant to occur, right? All right. So how do we understand fact versus fiction? So let's go back in history again. How did our society, and meaning society meaning who was responsible for teaching?
No audio.
Off of what? What are you on?
No one can hear on Facebook. But
On
other
Facebook.
comments are also
Okay.
saying that they can't hear you.
Thank you. All right, tell me, can you hear me now? Ha! That was a phone commercial. Can you hear me now? Hopefully you can. You still can't hear me? Why? Okay, hold on, viewers.
Now,
Oh, there we go. Sorry, I'm trying to use a microphone for both, and what I'm learning is that probably the computer is not picking it up. So we're back online. Okay, so how? Thanks, I appreciate the humor.
you're on now. Yes.
Okay, thanks. Marley's coming in and out, and I can hear myself echoing on it. So, how did we get here? How did the vast majority of families, of women, of mothers, of birth givers begin to decide that what they had been taught through the generations was that pregnancy was risky and that birth is unsafe unless you have so much technology and that you may need to be rescued, right? All right, how did we get here? Some of it is because of the challenges that women, birth givers, had because of those things that I talked about, the corset that caused the pelvis to get smaller, the things that happened with the depression that caused more bleeding and upset, the fact that in early years they didn't, yes, the hospitalization of birth. Thank you, Danielle. When birth went into the hospital, that added that to the fact that society began to be taught that babies could not be born unless they were in a hospital and there was a lot of bells and whistles around. Well, we know what we've learned is that in the beginning, women were put to sleep, right? They were given medications to put them to sleep. Babies were pulled out with forceps like I was. At no fault of our parents, that was just the way that it was done. And so it began to become something that continued. And so people began to be put into their minds that pregnancy and birth didn't work. And those who cared for them believed that it didn't work either because they saw so many problems. But how did the problems get there? Okay, so we have one is hospitalization. But what else created the problems other than lifestyle that has changed now? We have people eating a lot of food, sometimes not the best. Okay, what about the high mortality rate of moms and babies in the 1800s? Is that a false idea? No. Now, I'm not a historian in its fullness, so I can't tell you exactly what that is. But what I can say to you is that in that day and age, we did not know or understand about germs, and we know that those that were attending births were not doing good hand washing. we didn't always have indoor plumbing either, and indoor toilets. So we had more of a problem with bacterias and things that put infection at a risk. We also had people who were undernourished, and that meant that their babies came early or their babies didn't have a chance to grow like they needed to. So we had that. We had, the Dust Bowl. So we had situations that caused that society to have more difficulty birthing and being pregnant, and their babies having good survival. So when we walk through there, I don't think that's a false idea, but I do think that when we focus on the fact that maybe in the 1800s the mortality rate was what it was, the question is, did we continue that same practice that maybe helped at that time, but maybe wasn't as good as we moved up into the 60s and 70s and 80s? Because as we moved up and we moved away from some of those practices as far as how people lived, what their food sources were, and what their economics were, we began to become more of a socialized. And so what happened is birth givers said, I want to be awake. I don't want to be asleep anymore. So they had to accommodate that. They had to be awake. The other thing that occurred was we began to have physicians. Now, physicians are very good at high-risk pregnancies, surgery, and being able to rule out, problems that occur. But what about midwives? Let's bring this back to midwives. Midwives were attending births since the beginning of time, well before physicians and hospitals had babies being born in them. Now, there's nothing wrong with a baby being born in the hospital, in a birth center, or at home. And I want to put that right out here because everybody needs to birth where they feel safe. But what I want to bring to your consciousness is, why do you feel safer in a hospital, or why does someone feel safer in a hospital than feeling safer at home? And why does someone feel safer at home versus going to a hospital? Okay, so there's a big question, right? And we have that question that has to be answered. So what I want to bring up is that fiction versus, false news and the media. Okay, the false news, the false media, the fiction is what the population, society is being told today, with who we are today, with how we eat today, with how our lifestyles are, how we live, how we have indoor plumbing, indoor toilets, we have an abundance of available food. Sometimes someone has to be taught how to eat well so that they don't put their pregnancy and their birth at risk. Yes, that has to be done. So we go back to education. So false news and the media. When we look at that, okay, let's see. I think women have been taught to not trust their bodies and to be scared of all the minimal risk that comes with pregnancy and birth. Yes, that's my belief, and that's what I hear. When I go to do a fair, right? And I have this whole midwife booth with everything. And I think, wow, I'm so excited to be educating more women and more birth givers. What happens is I say to them, have you considered a midwife? And they go, oh, I could never birth at home. I'm too high risk. And I hear that so many times. So what's making them high risk? And how do we help educate a population into how to become low risk and educate a population that birth is normal, but you have to be able to help yourself make it normal, okay? And how do you have a care provider that can support you in educating you towards staying normal, giving you the education and tools that will help you create a healthy pregnancy so that you keep your risk factors low, so you're not having a premature baby so that you're not having high blood pressure, you're not having diabetes, you're not having all these things that are considered so much of our population that creates that high risk label. The other side of it is midwives. Now, there's differences in who midwives are. Okay, Julia, let's see. Also, that women believe the pain of birth is unbearable. Yes, I want you to remind me to get back to that, okay? Because that's such a key topic. Thank you for bringing that up. So we want to be able to have care providers that are good educators that look at you as a healthy, normal person and evaluate the things in your health that can be helped with nutrition, with supplements, with exercise, maybe with chiropractic, massage, acupuncture, stretching, doing journaling, and finding out how to help you have the best healthy pregnancy that you can for you and your baby. And not assume that it's every time you go in for a visit to whoever your care provider is, that they're looking for something that's wrong, always looking for something wrong, even though we as midwives are looking to make sure you stay healthy, right? Midwives educate you to care for your body and visit the areas of need. Thank you, Jennifer. That is our role. We're there to be good educators to you, because whose job is it to grow the baby? It's the mom's. It's not me. It's not a care provider. It's not a doctor. It's not a nurse practitioner. It's no one else's job to grow that baby. And it isn't their job to birth the baby. So let's move into that comment about the pain and the fear. So fear was what I started with on my Facebook Lives, okay? And I started with, how do we get to fear? We start, and so many people rely on the doc. Exactly. We put our trust in the care provider that they're going to take care of everything, that we don't have to do anything as the woman, that as long as we go to a prenatal visit and they say, oh, you're measuring okay, the baby's heart looks okay, you're fine, out the door you go. Oh, as long as you come into the hospital and you labor, we'll take care of everything else. This is a fiction. This is a lie. I'm sorry, but it is a virus lie, because no one is going to birth the baby but the mother, the birth giver. She's going to birth. Now, when you go for a cesarean section, yes, the physician is going to birth the baby, and that's the way it needs to be, okay? But let's go into childbirth. If childbirth is normal, how do we help a pregnant person prepare for a normal, healthy birth? And there are things that go into doing birth, such as how your pelvis is, its fluid and its flexibility, how the baby gets into the pelvis so that the baby can go through the pelvis well. We know that when babies get into funny positions, it takes work during that labor to help get that baby to rotate and come out. We know that the power depends upon how the pelvis and the baby are working with the cervix to talk to the uterus, to help the uterus want to pull on those chemicals of oxytocin to encourage everything to open to push your baby out. You know what? It works. But why are women so afraid of pain? Because that's all that anybody focuses on, is what is labor. Labor is pain. Labor is pain. Labor is pain. All right, go ahead and call it pain. You can, but don't equate pain that you've known all your life to injuries, because pain is there when you injure yourself. When you injure yourself, your body says, pain, stop, don't do anymore. I don't want you to get injured. I don't want you to hurt yourself. Just stop for a minute. That's right. So labor is power. And if you want to call it pain, great. It's pain with a purpose. But the more that you can adopt the word power, strong, intense, incredible. You will set in motion a chemical reaction in your body that will help you to deal with labor. And labor understands how to help all of your various chemicals, power, all of your various chemicals to work together. They're symbiotic. Your oxytocin talks to other things in your body. It makes neurotransmitters that help you to deal with labor, to be able to stay in your Zen place inside and be able to work with labor. Now, does sometimes labor really kick your butt? Yeah. Is it strong and powerful? You bet it is. And is it different for every single woman? Absolutely. Each woman, labor pain equals productive and natural. I love that, Danielle. That is great. It's rewarding in that time. That's right. Plus, when you have those labor, wonderful expansions, contractions, those two words just don't jive with me. They're opposites. Expansion and contraction. Your body is opening, it's expanding. Contraction means you're closing. Well, yes, it means the muscle's getting smaller. I get it, okay? But we have to expand and open so that baby wants to come through. And not only is our pelvis expanding, our muscles expanding, our cervix as the uterus pulls it open is expanding, but our spirits, our emotions are expanding. Our life is expanding. Everything is expanding. And that for some people is scary because it's vulnerable. That expanding is vulnerable. So let's handle the vulnerability. Let's handle the expansion. Let's decide during pregnancy to be able to prepare the pelvis so the baby gets in a good position, so that the hormones want to work right, and prepare the emotions. People ask us, how do women, birth givers, do it at home? And I say, they're not scared in the same way that women in a hospital are scared who ask for an epidural early in labor. Because they've prepared their minds, they've prepared their hearts, they've prepared themselves to say, I am the powerful one. I can do this. And I'm going to walk this path one expansion at a time. And I'm going to get there. Do they get to points where they say, I'm not sure I can do this anymore? Of course they do. Because that's normal. Because you get to that point where you're almost ready to push when you think, I just can't do it anymore. And that's the point where you're just around the corner and the baby's going to be ready to come. Now, sometimes, I get it, a baby turns backwards and those labors are longer, harder, and they are with more intensity. But when you can be up and moving, when you have those support people, ring the fire and your baby is there. I love that. Remember, I'm going to go back to it. Remind me about that. When your baby is in a funky position, their head is cocked, or maybe they're turned posterior, or maybe they have a hand up, or something is going on, that is the time when you've got to move. You need that support. You need to get those hips moving so the baby can shift. And you know what? Sometimes that doesn't feel good, but you know you can do it. Move your body. That's right. You have to move. Motion is lotion, and emotion is lotion. But sometimes when the baby's in a funny position, you don't want to move, which is exactly the time you got to get up and move. And that's what it takes, is people around you who trust that you can do this, that babies will come out. We had a fantastic mom who made a little sign for us that I've shown you a few times. It says, babies come out. And that sign is something I look at often. I've shown to other birth givers and moms to remind you the babies do come out. So when they come down, we talked, Jennifer mentioned that ring of fire and your baby is there. You're right. As the baby's coming down and you start getting that stretching, as it really stretches your perineum, you start feeling that burn feeling. It's huge, right? Wouldn't you all say that that feeling is huge and that you want to push through it or you want to back off from it, right? Am I right? Yeah, that was me. That's right. Thank goodness for my support people to help me move through. Right on. But I want you to remember it was you that did it. You did it. You birthed your baby as that baby came through. So when that baby comes through that perineum and there's a burn, yeah, it's everything you can do. And when you're guided through that, that perineum is going to stretch and stretch and stretch, right? Sometimes it has to give. If it has to give, let's make it give just a little. And that's how being present, being in your body, being aware of what the sensations are, owning them, empowering yourself, that's how you do it. So when you ask people, why and how in the world did you ever birth at home? You, those of you who birthed at home, stand up and tell them how you did it. Because I know that so many times you hear stories that they need to tell you because they've had a lot of trauma in their birth. I don't want trauma in your births anymore. I know birth can be hard sometimes, but you know what? You can do it. You can make it. Now, once in a while, a baby has to be born by cesarean. Because you believe in your baby and yourself, yes, the I love, 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 love that sign. Okay, now here's my question to you. How many babies should be born by cesarean? There's my question. Feed it off to me. How many babies do you think should be born by cesarean? Give me numbers in 100 or give me percentage. Ha, I like that. Jennifer, you're awesome. I love 0. That would be nice. Okay? That would be great. Okay? 10%. All right? Who else? 3%. Okay? Who else? Come on. Keep feeding me. Where's my Facebook group? How many? Oh, I guess I have to scroll down. There we go. Okay, 10%. Nice, Jen. What is it that people think? Okay, I'm going to come back to that one because I really like that. All right, so the World Health Organization, which is somebody who kind of watches over all of how birth happens in all countries, not just in the US, not just in third world, but in all countries, they say it should be under 10%. So if it's supposed to be under 10% in the global standpoint, why is it that we in the United States, who are one of the most socialized countries, it is 33%, or 1 in 3 babies are delivered by cesarean, right? And we have one of the highest maternal mortality rates in the world. So, how do we lower that? Okay, Jessica Webb, 2%. I like that. So in our practice, we have about maybe a 2% cesarean rate. Out of 100 women, 2. So why is that? That midwifery care, when they are planned at home, and I would say probably most birth centers keep themselves under that 10%, okay? And every practice is different. How in the world do we have women, because it's you, it's not us that's birthing those babies, it's you. How is it that we keep that at about 2%? It's because we educate you, right? It's because we educate you and we're looking to make sure that you know how to make sure that pelvis is fluid. I want you to take this and I want you to tell your friends, your family, people you meet at the park. Go to your mom's groups and say, Here's what I learned. These are the 3 basics. You have to have a fluid pelvis. You have to have a baby in the right position, and you have to have a heart that wants to work with that power. Jennifer says, understand your body and birth. Exactly. You have to be able to understand it so that you can work with it. And that's how you keep from having interventions, complications, and a cesarean delivery. Now, some cesareans are scheduled. Mindset, exactly. Some cesareans are scheduled because they think a baby's not growing well or a baby gets too big. We know that one, right? And those too big babies, anybody who's been to our office knows that the average baby is at least about 8 pounds to 9.5 in our practice. Do we get smaller babies? Sure. Do we get bigger babies? Absolutely. Those babies all come out, at home, right? Without all the bells and whistles. But it takes a good practitioner, a good care provider to make sure that you are listened to, right? Because it's not just about measuring your belly and listening to the baby. Okay, once we know that baby's growing well and your body is handling the pregnancy, what else do you think your care provider needs to provide to you as the woman or as the birth giver? What does a care provider need to do? Da-da-da-da-da-da-da. How are we doing over here? We're good. What is it? You make me tell you? It's making sure of what's going on in here, right? Because there's a great statement that one wise author about birth said that so as a woman lives, so shall she give birth. So as a care provider, we need to know you. We need to understand who you are in every way that we can. Because the more that we know you, the more that we understand who you are and what's important to you, how your life is, what some of your life circumstances are, will help us to better understand how birth is going to occur, how we can give you some guidance beforehand to deal with that. Maybe we have a birth giver who's had a cesarean in her prior pregnancy, and it was at 7 centimeters, and she got stuck at 7 centimeters, and she never progressed past it for hours and hours and had a cesarean. In your birth, with a VBAC, with a birth giver like that, you never tell her she's 7 centimeters, because what do you think's going to happen? Her mind is going to click, and her body's going to go into fear, and she's going to be, oh no, it's going to happen again. I don't want it to happen. And fear and trust in birth have a conflict of interest. Birth demands trust. Birth demands that you open to it, that you breathe into it, that you say yes to it. Birth demands this, because if we go into fear, then we have adrenaline that begins to be secreted, and adrenaline and the birth hormone oxytocin can't work together well. So you need a place that's safe. Yes, Jennifer, thank you. You need a safe place. Now, if safe means that you're in the hospital, then you need to do that. But address why you feel you're safe in a hospital and what you expect them to do for you. Because if you want them to do things for you, they will intervene, and interventions can cause complications. Because my motto, this is the world according to Kaleem. If you complicate birth, you're going to create complications, which then create more interventions and more complications, and then the cascade of events continue. That's my motto, right? All right, so another Jennifer, we got lots of Jennifers on tonight. This is Jen, who lives in Texas. It's actually my goddaughter's mommy. She said, what is it that people think a doctor will do for you during your pregnancy in 5-minute visits, blood pressure check, and tests? Okay, so we go back to that. Now, do I appreciate the docs? You bet I do, because they understand higher risk and understanding how to use tests, medications, and surgery and hospitalization when that is the best that a baby and a mother needs. Okay? That is important. But what we need is to bring that percentage way down. And we do that by women and birth givers educating themselves and taking responsibility to feed themselves well, use supplements, do their stretches, get those things flexible for the birth, and be able to get ready for a full-term, good birth with people around you, whether that's a doula in a hospital that keeps the interventions low, and you've already prepared that you're not going to have all the bells and whistles, or you look for an out-of-hospital, being it whether it's a birth center or at home. So fact or fiction? Fact is, pregnancy is normal. People can get pregnant, and even if they have to have assistance to get pregnant, they are the ones that are going to grow their baby, and they are going to birth their baby unless they turn it over to someone else. Birth happens within the person who has been growing that baby all along. They know how to birth. Let's remind them of what they've always known that was in there before they were born, that they know how to do it, and help people, help society regain trust. Regain trust in pregnancy and birth. And at a future Facebook Live, we're going to talk about trust in breastfeeding. That's a whole nother topic, and in your baby. Well, this has been a great interaction time. Thanks everybody for joining me. I loved talking about this topic. I, for years, was afraid to just say anything. Now I'm realizing that as long as we speak up, as long as we tell others and we share with them that they can trust, that they can find that birth that they want, that they can have a natural birth if they just create the right setting, care provider, and know what they want to create. All right? So thanks for tuning in tonight. Please, if you haven't already, go and check out the 40 P's of pregnancy, which is really pregnancy, birth, the postpartum time, the baby, everything like that. If you go on my Instagram page, click the 40 P's, it'll start you running, and you'll get 40 amazing short videos that are going to tell you a lot of information. And if you don't feel like you need them anymore because maybe you're overdoing that, use your voice and share, empower others. Exactly. Share that information with other people. Get them on so that they can hear my series, okay? These were done to help educate. And I'm working on the full series, the full expanded version. We're almost, probably by the 1st of March, we should have the pregnancy side that'll give everybody that education to know how to create a happy birth, a healthy birth, a positive birth, an empowered birth. And then by the beginning of May, we're going to have the birth section, the postpartum section, the breastfeeding section. And you know what? It's time to bring midwifery to the masses. Don't you think? That's how I feel. So we're going to make it happen. I'm so grateful for all of you. And my closing line is, go in. Thanks for the claps, Jennifer. Go in. Oh, thank you, everybody. Mandy, Jennifer, all of you for coming. Navarre, Mandy, okay. So here's my closing line for everybody. Go in. Give your children a hug. Tell them that they are amazing and that they can accomplish anything they set their mind to do, because they are our future. I know some days it can be challenging, but just keep reminding them that they can be amazing in this world and accomplish anything they set their mind to. All right, have a good evening. Stay tuned and keep watching. Bye for now.